We are live now, doctor.
Okay. So good evening, postgraduates, and namaskar to all the mentors who have logged in for the first quarterfinal of this season. For the information of postgraduate, remember today's scout pin is 6584077. And as already we have shared in the WhatsApp group, write your team name, whatever has been suggested. Please don't write your personal names. Otherwise, your counting will go haywire and we will not be able to do so. For the people who are not into the quarterfinals, they can play in the private practitioner category. And there you should have your logo should be mobile number followed by your name. For example, it can be private practitioner, your mobile number, and then any three digits you can use it as a team identifying yourself so that other teams who are not into the quarterfinal one can participate and practice for this session. Okay. So welcome to this Pan-India Intercollegiate Quiz, which is being organized by Brain Teasers in association with Ophthalmological Society of Nagpur, the Big Q. So this
समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर हट समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So good evening, friends, and once more my pranam to all the mentors. Brain Teaser again welcomes you to this very first quarterfinal of this fourth season of Big Q. As you are aware, Brain Teaser is an online platform for hosting quizzes for ophthalmologists of our country. Since last 6 years, we have been doing the same. It was 3 years back when the thought came that we should have an exclusive quiz for our postgraduates. And with the same intention of getting all the postgraduates from across the country on a single platform, Big Q was born. Remember, there are approximately 320 institutions who offer post-graduation in ophthalmology, be it MS or DNB. And it was the first time we got them all on a single platform, giving them a playing level field. And I'm really happy that this particular Big Q is blooming day in and day out. In this particular season, we have, as on date, more than 380 teams which has participated in this particular season. And in this fourth season, we had 6 preliminary rounds which are through. And based on their calculations, the best 4 performances, we are having the 4 quarterfinals. Each quarterfinal will be having 20 teams. And once we have 4 quarterfinals, we will have 2 semifinals and 1 finals. These episodes were being aired alternate Wednesdays at 7:30 p.m. Because of All India Ophthalmological Society meeting last weekend and following that, we could not have this particular episode. And in the Brain Teaser, session 2, would be again on the following Wednesday itself. Brain Teaser team is extremely thankful to the team of quiz masters who have toiled hard to create a wonderful experience of learning with fun. Today's episode, we have few of the veterans who have been regularly with Brain Teaser team. First and foremost is Dr. Mamta Singh, who is currently working as an assistant professor in ophthalmology at AIMS Rajkot. We have another veteran who has been with us, Brain Teaser, since last 6 seasons, Dr. Uma Kulkarni, who is a professor in ophthalmology at Yenapoya Medical College. And the third quiz master is Dr. Anuradha A, who is an associate professor at Minto Ophthalmic Hospital and RIO, Bangalore. I'm really thankful for taking all the pains for creating such a wonderful experience to all the quiz masters. Money maketh the mayor go is an old saying which I have been saying almost at every episode, and we are really thankful to His Highness team. My sincere most gratitude to Mr. Suryanarayan and Mr. Naresh Rautela, Kaustubh, and the whole team for having put on such a big show for us and enrolling more than 370 teams with us for this particular episode. Any online program needs a smooth and flawless execution, and this Brain Teaser platform is being executed and managed by Numeratic and team. And my sincere thanks to Numeratic and team and Mr. Sai and his team for the same. Now, without much ado, can I request my co-host, Dr. Shilpi Narnavre, to take over and familiarize you with the rules of the this particular episode. Over to you, Shilpi.
Thank you, sir. So welcome back all the friends. So hope you all are geared for the quarterfinal 1. So these are our today's quiz masters for quarterfinal 1. So let's see what will be the format for the quarterfinals. So in quarterfinals, we will be having total 80 teams. So 20 teams per quarterfinal we have selected. So today is the first quarterfinal. Second quarterfinal will be on the next Wednesday itself. That is on 23rd April 2025. So for teams, again, you need to log in from 2 devices. That is Kahoot and also on the Zoom platform. First is the live quizzing on the Zoom platform. For today's quarterfinal, out of the 3 rounds, 2 rounds will be out of 2 rounds, basically, it will be one, will be face to face with the quiz masters. And the second screen is the Kahoot for MCQ round. That will be played by both the audience and the teams. So out of the 20 teams, 5 teams will qualify for the semi-finals. And what will be the criteria? It will be the respective quarterfinal marks, means the marks you will get today and your previous best 4 performances of the preliminary rounds. So what are the rules? So the format will be, you will have 3 sets of MCQs. Each set will have 5 questions. This will be played both by the teams and the audiences. There is no negative marking in the MCQ round and you will get 10 seconds per MCQ. Now, coming to the rapid fire round, that will be only for the teams. So in rapid fire round, every team will have to answer 5 questions in 30 seconds time. Remember, there is negative marking in this. So for correct response, you will get plus 10 marks, while for the incorrect answer, you will get minus 5. So if you don't know the answer, say pass or don't answer, there will be no negative or positive marking for that question. So, another important thing. Teams who are not playing today's quarterfinal or the teams who haven't qualified for any of the quarterfinals, you can play as an audience or as an individual in the private practitioner category. So don't use your team name if you are not playing today's quarterfinal. Just write your mobile number and some name so that we can identify. And if suppose you are in the top 3 in the private practitioner category, you will be eligible for the prizes in the private practitioner category. So these are the prizes for the private practitioner category or the audience prizes. So now let's start the quiz. I'll introduce our first quiz master, Dr. Mamta Singh. She is assistant professor in ophthalmology at All India Institute of Medical Sciences, Rajkot. She has the best poster presentation at Asia Pacific Ocular Imaging Society meeting at Singapore 2020. Dr. Anjani Kishore Gold Medal for her best video in 2019 at Bihar Ophthalmological Society. Dr. D.K. Bose Gold Medal Award for Best Free Paper in 2018 at Bihar Ophthalmological Society. And Dr. Ajit Sinha Gold Medal for Best Poster in 2008 in the same society. She has to her credit the multiple index publications and chapters in the books. So with this, I hand over the screen to Dr. Mamta.
Good evening, everyone, and I hope I'm audible. Am
Yes,
I audible, Dr. Shilpi?
Yes, ma'am. Yes, ma'am.
Yeah. Thank you so much for these kind words, although I had written this. No. So, good evening again, and we are going to have some, some challenging questions, some fun-filled question, and it's going to be really interesting. So let us all dive into the first question straight away. So the first question for you is, a 40-year-old man presents with redness, proptosis, and ophthalmoplegia. He has shortness of breath and hematuria. The investigation of choice in this case will be option A, it is C ANCA. Option B, it is P ANCA. Option C, it is anti-nuclear antibodies, or option D, which is rheumatoid factor assessment. And the time starts now. Time's up. The correct answer for this question is C ANCA, and the probable diagnosis, as you must have guessed, is vaginous granulomatosis, which is actually an autoimmune disorder affecting or causing the inflammation of blood vessels. The commonly affected organs are lung, kidney, sinuses, nose, throat, and that is the reason of having hematuria, etc., and eyes, of course. Moving to the next question again. Mitochondrial encephalopathy, lactic acidosis, and stroke-like episode, or Maillard syndrome, is characterized by all except. Options are option A, progressive external ophthalmoplegia. Option B is cortical blindness. Option C is lens subluxation, and option D is optic neuropathy. And here goes the timer for you. Hope you get the right one, and the correct answer here is lens subluxation. If we talk about Maillas, then all the given options, they are the manifestation of Maillas, but not lens subluxation. In lens, we get cataract, and hemianopia and cortical blindness, they are features of stroke-like syndrome that is a part of Maillas. So moving to the question number 3 that we have today, the only FDA-approved treatment for Demodex blepharitis, that is lotilaner ophthalmic solution, is used in concentration of option A, 0.5%, option B, 0.25%, option C is 1%, and option D is 0.75%. And the time starts now. Time's up. The correct answer here is option B, which is 0.25%. It is basically a parasite-specific chloride channel blocker, which actually paralyzes the Demodex kit and eventually they die. That is how it works. Moving to the next question that we have. False statement about TAS, or toxic anterior segment syndrome, is option A is adrenaline in irrigating fluid can cause it. Option B is these patients, they present with AC inflammation within 12 to 24 hours of surgery. Option C is it is characterized by severe pain, and option D that we have is it responds rapidly to intensive topical steroid, and the timer goes on now. So the correct answer here is option C, which is characterized by severe pain. In TAS, there can be multiple level of pain or discomfort, but pain is actually not a characteristic feature of TAS. That is the reason here the option C is the correct answer. All three otherwise are correct. So moving on to the next question that we have. Increased risk of rheumatogenic retinal detachment is in all except option A, which is lattice degeneration, option B, which is retinoschisis, option C is cystic retinal tuft, and option D is microcystoid degeneration, and the timer starts. Time's up, and the correct answer here is microcystoid degeneration, which is actually a precursor of retinoschisis, but not retinal detachment. It is basically cystic structures that we get to see mostly on the temporal retina. So with this, you will be facing the next quiz master, Dr. Uma ma'am, who is, going to really test your intelligence. She has this teaching experience of more than 20 years. So you all can imagine, the kind of questions you are going to face. She has more than 35 publications in her kitty. She is interested in ophthalmology and beyond ophthalmology also, which is photography, birding, and poetry. And you can see that in the photograph also. She has vast knowledge and experience in the field of research ethics, medical education. She is 10 times the PG quiz master. So, get ready. Just keep your thinking cap on. That is all I can say. And she has multiple awards also, like she has received the Outstanding Teacher Award at Forum of Ophthalmic Teachers in India, or FOTI 2024. She has received the Best Teacher Award in Yenopea 2018 and Best Researcher Award in Yenopea again in 2025. So over to you, Uma ma'am.
Thank you so much. Thank you, Dr. Mamta.
Thank you, ma'am.
So, shall we start?
Team 1 is, ma'am, Team Abby and Divs.
Yes,
ma'am. Yes, please keep your audio and video both on, and please introduce yourself.
Good evening. I'm Dr. Divya, and
I'm Dr. Abhinaya.
We are from Dr. Agarwal's Eye Hospital in Chennai. We are doing a second year DNB.
Okay. All the best to you.
Thank you. Thank you.
Is ma'am audible properly to you? Uma ma'am?
Yes.
Okay, so shall we go ahead? Once again,
Sure.
the rules for rapid fire is you will get 30 seconds. There will be 5 questions which will be displayed. You need to answer it one by one only. Okay, if you feel like you don't know the first answer, just before giving the answer, tell us that you are answering the second question or the third question. Okay? Okay, so let's start.
Yeah. So, who invented LASIK? Question 2. Drill is an OCT biomarker for neovascular AMD. True or false?
True. Second is false, ma'am.
Okay. Third, nature of retinoscopic reflex.
Scissoring
Fast, you will have to.
reflex.
Yes, scissoring is correct. Heads.
Pass.
Fast. Plus disease in which eyelid condition? Okay. So they get 2 right. Second
Yes,
one
ma'am.
and the third one.
Yes, so plus
Okay.
20.
Plus 20 for them. So the first answer is payment. The third is herpetic eye disease study. And the last one is meibomian gland dysfunction. Yeah.
Okay, great going.
Correct.
Okay? So,
Good.
yeah.
Good.
Thank you.
Not
Next team.
even the wrong answer is equally important.
Is like scoring
Yes.
over the other teams. Yes.
So the team 2 is Team IQ from Chhattisgarh, Raipur. Aims.
So if you don't know, say no so that I go to the next question. It becomes faster for you.
Yes.
Okay.
IQ,
Team
please
2.
introduce. Huh. Team 2. We can't hear you.
Team 2.
Sai, can you hear them?
When they are very much on Zoom, they should be able to hear us. Can you? Team 2, can you mute and unmute? Can you increase your volume now and try speaking?
Okay. Meanwhile, we move to next team. Sai, can you just check with them?
Will do.
Okay. Meanwhile, team 3, that is I Ninjas.
Yes, ma'am.
Yes. Please introduce yourself.
Ma'am, I'm Dr. Chandravadan from Arvind Hospital, Coimbatore, second year resident. Ma'am, I'm Dr. K. Sai Teja, Arvind Hospital from second year resident from Arvind, Coimbatore. Sorry.
So, ma'am, shall we start?
Yes.
Okay.
Okay. Questions for you. Who is father of coecoemulsification?
Charles Gilman.
In retinitis pigmentosa, both A and B waves of ERG are diminished. True or false?
True.
Secondary open angle glaucoma caused by photoreceptor outer segment is called.
Schlossman.
Okay. Expand SCUT, SCUT study.
Steroids in corneal ulcer trial.
And last one, brush type, umbel, terminal, and arborescent are types of.
Superficial corneal vascularization.
Very good. Except the third one. Third
The
one,
second
you
one.
said Schlossman. You want to take it?
Schwartz.
Yeah, it's so except one, that is they answered one wrong, so they'll have 35 points. 10 plus 10 plus 10 plus 10 and minus 5.
-5.
Very well done. Very well done.
Thank you. Thank you, ma'am.
So
Yeah.
plus 35 from this round. Okay.
Yes.
So the next team is team 4. Iconic. Team 4, Iconic.
Yes, ma'am.
Please introduce yourself.
Hi, ma'am. My name is Dr. Kasturi. I'm from Arvind Eye Hospital, currently in my first year of DNB residency.
Good evening, ma'am. Dr. Sakshi Kole, primary DNB first year from Arvind Coimbatore.
Okay. All the best to both of you.
Ma'am, let me interrupt here. I am
Yeah.
seeing one more team, the Iconic team. Are you from team Manipal, KMC Manipal?
No, we are from GMC Aurangabad.
GMC Aurangabad, Iconic T. So please write
Yes,
it
ma'am.
T in front of your team because there are 3 teams with the name of Iconic.
Yeah, we are the iconic team. But
Nee,
in our
T.
Kahoot, it is displayed as the iconic T.
Yeah.
Acha, Kahoot is Iconic T.
Yes.
Here also please make it Iconic T. It will be easy
Okay.
for us to mark, है ना? एकदम.
Okay.
Yes, ma'am.
Okay. So, okay, ma'am. So, team 3 Iconic from Arvind Eye Hospital, Coimbatore. Ma'am, let's start.
Okay. Yeah, sure. So here are your questions. All the best. Who's the father of pars plana vitrectomy? Maxillary sinusitis is the most common sinusitis associated with orbital cellulitis. True or false? False, I heard. Classic appearance of keratic precipitates in Fuchs uveitis syndrome. I couldn't hear you clearly. Somebody has to help me. Okay. Okay. Expand AGIS.
Pass.
Okay.
Last.
There was some voice problem there. I couldn't hear them.
So,
Okay.
last we can give them. If you
Yeah,
want to
we'll
answer.
give them. Quickly, loss of eyelash in recurrent chalazion should lead to a suspicion of?
Carcinoma.
Okay.
Which carcinoma?
Sebaceous gland carcinoma.
Let's see.
Yeah, we can give it to her. I think so. Stellate is correct. I think she said it. Then
Yes, ma'am.
false is correct. So they have 3 right. And the first answer is Macklemore. And the one you missed out is advanced glaucoma intervention study. Well done.
Thank you, ma'am.
Okay, ma'am. So, next team is
Just hold your mic close to you or whatever. Just be closer.
Sorry, ma'am. Thank you.
team
Yeah.
5, Lensomedics. The inside out team.
Yes, ma'am.
Yes, ma'am.
Okay. So, please
Okay.
introduce yourself.
This is Dr. Jaishnavi. This is Dr. Shreya. We are a second year residents from Bharati Hospital, Pune.
Okay. So are you ready?
Yes.
Yeah. So your questions are here. Father of fluorescein angiography.
Pass.
Pronlin is associated with lateral wall orbital decompression. True or false?
True.
Okay. What sign is perilimbal vitiligo in VKH called?
Pass.
Expands GLT study.
Pass.
And last one, express mini glaucoma shunt is made up of?
Pass.
Pass. So they get 1 right, that is Cronlin. And the first answer is Harold Novotny and Alvis. Sign is Sugiura sign. GLT is glaucoma laser trial. And the material is stainless steel. Never mind, you score 10 points here. Good.
Team 2, can we try your audio now?
Hello.
Yes, ma'am. Are we audible?
Team 2 IQ.
Yes, ma'am. Are we audible?
Yes, yes. So, ma'am, shall we go ahead with them? Team 2.
Yes.
Okay. Please introduce yourself.
Hi, I'm Dr. Mustafa, PG, AIMS Raipur.
I'm Dr. Sanya Parak, PG AIMS Raipur.
Sorry, we can't hear you.
I'm Dr. Sanya Parak, PG AIMS Raipur.
Okay.
Okay. So, ma'am, shall we start?
Yeah, be clear in the while answering the questions, okay? Okay.
ma'am.
Yeah. Team 5.
Yes.
Your time starts now. Who invented GAT, a type of IOP measuring device?
Pass, ma'am.
Okay. Pupillary reflexes are normal in the right occipital cortex, in fact, true or false? First, unilateral central foveal suppression scotoma with absence of bifoveal fusion and presence of peripheral fusion. What is it called? Okay, expand CNTGS.
Collaborative normotensive glaucoma
Okay,
study.
yeah, we give it to you, but you lost lot of time in not answering and not saying pass in the first 2 questions. The last question, just like that, I can ask you, weekly regime is followed in which antimetabolite in uveitis? Okay, that's fine.
Methotrexate, we are not sure.
Yes.
Yeah, okay, but you can't get the points because you missed a lot of time there.
Later, they actually answered the second question true, so I have given them the
They
mark.
said it?
Yes, ma'am.
Yes, ma'am.
Okay, okay, fine. So
Okay, ma'am.
20 points to them. Raipur team, well done. First one is Hans Goldman, which we should not forget. And the third answer is microtropia or monofixation syndrome. And the last answer is obviously methotrexate. Yeah, that's from me. So I have this opportunity to introduce Dr. Anuradha. She is MS Ophthalmology and a fellow in glaucoma. She's associate professor in Minto Ophthalmic Hospital and Regional Institute at Bangalore. She has a work experience of 14 years in teaching ophthalmology, both UG and PG. She's also MBBS coordinator and curriculum committee member at Minto. She's specialized in glaucoma and cataract surgeries. Ocular trauma is her special interest. She's presented many papers and published many articles. Best paper award in neuro-ophthalmology as COSCON in 2019 and first prize in photography competition in COSCON 2022. She's a life member of many ophthalmic societies, including the Women Ophthalmic Society. Over to you, madam.
Thank you, Mama, for this introduction, and
you.
good luck all the teams. And thank you, Big Q team as well, for conducting such a good program year after year. Can we start?
Yes, ma'am. So the next team is Team 6, the iconic T from GMC Aurangabad. Please introduce yourself. Yeah.
Good evening. I'm Dr. Imad Khwaja from GMC Aurangabad.
Good evening, ma'am. I'm Dr. Vaishnavi Deshmukh, Resident Doctor at GMC Aurangabad.
Which year students are you? Which year?
Third year.
Third year.
Okay. Okay. So let's start.
Yes, ma'am.
Who invented the modern autorefractors?
Pass.
Pass.
A patient with bilateral optic nerve head drusen and no other symptoms requires immediate surgical intervention. True or false?
False.
Horizontal breaks in Descemet's membrane occurs in congenital glaucoma.
They're called as?
Expand IATS.
Half stay.
Half stay.
Third is
Expand
half stay.
IATS.
Pass.
Field of view of ultra-wide field retinal imaging.
Pass.
Okay. So 2 correct for them now.
Second one and fourth one.
Second
So,
and third. Yeah.
Our first answer is Tom Consweet And the second answer is false. Third one is abstray, and IATS stands for Infant Aphakia Treatment Study. And field of view is 200 degrees in ultra wide field retinal imaging.
Thank you.
Thank you.
So the next team is Team 7, V Bhagyashri. Bhagyashri team. Team 7. Okay. I think she is not there. So we move on to the next team. That is Team I Squad.
Good evening, ma'am. Good evening, ma'am. I'm Shamli. I am Sadaf. And we are residents from JJ Ophthalmology.
Okay. Ma'am, shall we move?
Yes, yes, we should move on.
Okay. So your time starts now.
Father of automated perimetry.
Pass.
Patient, yeah, you want to answer?
Pass.
No, pass.
A patient with bilateral central scotoma and normal fundus examination definitely indicates macular degeneration. True or false?
False. False.
A remnant of hyaloid artery attachment located on posterior lens capsule.
PHPV. PHPV.
Expand MUST.
Pass.
Principle of TNO test. Okay, so we can't give this to you. I think you answered second one.
Ma'am, third was wrong and second was right. So plus 5.
Okay, father of automated perimetry is Franz Frankover. And the remnant of hyaloid artery attachment at the lens capsule is Mittendorf's dot. And MUST stands for multicentric uveitis steroid treatment. And principle of TNO is random dot stereogram.
So we move on to the next team. Team 9, that is Chanakya. Chanakya team, are you there? Team Chanakya? Okay. So we move on to the next team, that is Team Oculus. From Bangalore?
Team Oculus is here.
They joined, ma'am, actually. Team 10, Oculus. Yes, they are there, ma'am. Yes, yes. Please be closer to the mic and introduce yourself.
I'm Dr. Aishwarya from KIMS Bangalore. Dr. Meenakshi from KIMS.
Can we start, Dr. Shilpa?
Yes.
Which person pioneered the use of excimer laser for refractive surgery? PCO is inevitable complication following cataract surgery that always requires immediate intervention. True or false?
It is false. False.
Characteristic ring around the corneal limbus caused by copper deposition in Descemet's membrane.
Pleasure. Carefree.
Expand score.
कैसे connect करेंगे?
Drug of choice for sino-orbital mucormycosis.
Okay. It is not able to read only.
Okay, I think you have answered 2 right.
Last question, they have said pass.
Drug of choice.
Amphotericin B.
Okay.
Oh, we answered 3. Yeah, that's correct.
Okay. It was Stephen Trokel in 1980s, excimer laser use. And second one is false, yes. KF ring for copper deposition. SCORE stands for standard care versus corticosteroid for retinal vein occlusion. And drug of choice for sino-orbital mucormycosis is liposomal amphotericin B. But Dr. Shilpi, I think the time was over for the 5th question.
Yes, ma'am. But okay, 5 seconds here and there.
Okay, you can consider it's up to you.
Yes. So the next team is Team Ironic Squad.
Hello.
Hi, please introduce yourself.
I'm Dr. Yathat from KMC Manipal.
And I'm Dr. Prachi from KMC Manipal.
Can we start, Dr. Shilpi?
Okay, yes, ma'am.
Who invented the first ophthalmic ultrasound imaging system?
Pass.
In pediatric ophthalmology, amblyopia can only be effectively treated before the age of 7 years. True or false?
False.
Pupils that react to accommodation but not to light, typically associated with neurosyphilis.
Argyle Robertson.
EGPS. Thanks for.
Pass.
A 4-prism base out test is used for the diagnosis of which condition?
Esotropia.
Wrong. Okay, so let's see the answers.
Okay, Ivan Greenwood was the one who introduced B-scan. And second one is false. You told third one also correct. Fourth one you didn't answer. And fifth one is microtropias, monofixation syndromes. It
So
was the
there are
wrong
two
answer.
correct, one wrong. So it comes out to be 15.
15.
Yes. So the next team is team 12 Avanchi. They haven't joined. So next in order is team 13 Epic Eye. Team 13.
Good evening, ma'am. My name is Dr. Arpita Shringi and I am from MJ Medical College, Indore.
Good evening, ma'am. I'm Singh from MJ Medical College, Indore.
Please switch on your video. Team 13.
Arpita Shringi is the name you have written, na?
Yes, ma'am.
Later on, please change it to the team name. Okay? And be closer to the mic. Shall we start?
Yes, ma'am.
You are not audible properly.
Yes, ma'am. Hello.
Okay, yes.
Yes, ma'am.
Who invented slit lamp? Uveitis of unknown etiology always require immediate systemic immunosuppressive therapy. True or false?
Ma'am, false.
Optic atrophy in one eye, papilledema in contralateral eye associated with frontal lobe tumors. What is it called? Expand, beat, ROP.
Ma'am, better early screening treatment for atrophy of prematurity.
What is the scleral incision size for 27 gauge vitrectomy system?
Pass.
Okay. They answered two correct.
Yes, it was Albert Gullstrand in the year 1911 who invented slit lamp. And uveitis, always it did not need immunosuppressive therapy. And optic atrophy in one eye and papilledema in another eye in lesions of frontal lobe tumors. It's called Foster-Kennedy syndrome. Beat ROP stands for bevacizumab, eliminates the angiogenic threat of ROP. The scleral incision size in 27 gauge vitrectomy is 0.4 millimeter.
So plus 20 to them. Okay. So with this, we end with the 10 teams rapid fire round. And it's time for the commercial break. We thank the His Highness team for this. So let's again, I request Dr. Mamta Madam to please go ahead with the MCQ set 2.
Thank you, Shilpi. So let us start with the second set of questions and fingers on your keyboards. We'll start with the first question of MCQ set 2.
Yes, just refresh your Kahoot, please. So we are starting with the MCQ set 2.
Which of the following is not a mitochondrial disease? Your options are: first, option A is chronic progressive external ophthalmoplegia or CPEO. Option B is LHON, that is Leber hereditary optic neuropathy. Option C is dominant optic atrophy or DOA. Option D is gyrate atrophy. And the time starts now. Time's up. The correct answer here is option D, which is gyrate atrophy. It is autosomal recessive disorder, and it is mainly because of mutation of OAT gene. Moving on to the next question that we have with us. That is, Ehlers-Danlos syndrome is characterized by all except. Options are: option A is myopia, option B is keratoconus, option C is epicanthal fold, and option D is MAP dot fingerprint dystrophy or epithelial basement membrane dystrophy, and the time starts now. The answer here, which is MAP dot fingerprint dystrophy or epithelial basement membrane dystrophy. It is Wilson, and in the presentation, we get to see membrane dystrophy. Moving on to the next question that we have today. Alport syndrome is characterized by all except. Option A is shallow orbit. Option B is hypertelorism. Option C is uriblepharon. And option D is down slanting palpebral fissures. And the time starts now. Time's up. The correct answer here is option C, which is uriblepharon. All the other features that we get to see, because as this is craniosynostosis, we can see the other features definitely here. But uriblepharon is definitely not one thing. So moving on to the next question that we have. Ocular feature of Bardet-Biedl syndrome is all except. Option A is macular atrophy. Option B is myopia. Option C is nystagmus. And option D is cataract. Your time starts now. Time's up. The correct answer here is option B, which is myopia. Bardet-Biedl syndrome basically is not ciliopathy actually, and we get to see retinal degeneration, RP, cataract, refractive error, but not refractive error, myopic refractive error here in this case. The next question for the set 2 is Kearns-Shire syndrome is characterized by all except. Option A is unilateral ptosis. Option B is pigmentary retinopathy. Option C is myopathic phases. And option D is cardiac conduction defects. And the time starts now. Time's up. The correct answer here is unilateral ptosis. It is basically a mitochondrial disorder, and the problem here would be bilateral ptosis, not the unilateral ptosis. It is characterized by the triad of onset before the age of 20, CPEO, and pigmentary retinopathy. With this, I think we have come to the end of MCQ set 2. Moving on to Uma ma'am for the next set of rapid fire questions.
Okay, I'm ready.
Yes, sir. So the next team is team 14, glaucoma flecken. Have you joined? Team 14?
Yes, ma'am.
Hello?
Hello, ma'am.
Yes.
Yeah, ma'am, we are joined.
Yeah, please introduce yourself.
I'm Avina from Minto
Video.
Hospital, DMS, Bangalore Medical College.
Be
Hello.
closer to the mic and louder.
I am Avina from Minto, from Bangalore Medical College.
Okay.
Okay. So,
Can we have your video on the team? Okay.
shall we start, ma'am?
Yes, I'm ready.
You have We can only see the AIOS ARC webinar,
Yeah.
but not your faces.
Ma'am, actually,
We can't hear you also properly.
Yes.
Okay.
Ma'am,
And
can you hear me? No.
Ma'am,
We
shall we
can't
move?
see you.
Hello?
Yeah, it's okay. We can go ahead. Only thing, be clear when you're answering. Otherwise, it will lead to loss of time. Okay?
Okay.
Okay. Okay. Yes. Your first question. Who invented kinetic perimetry? Infranasal quadrant of the bulbar conjunctiva is characteristically stained in mucus fishing syndrome. True or false? Limbal nodule
False.
resulting from delayed hypersensitivity to microbial antigens is called. Expand ion dt. Last one. Which macular complication is associated with intravitreal gentamicin? No. So they were not able to open their account
No,
today.
ma'am. They said Goldman's for the first answer.
Did they?
Yes,
Okay.
yes. For the second, they said false, which is true. Basically, it's
Yeah.
+5 for them.
So plus 10 minus 5.
Yes.
Okay. So the answers are Hans Goldman and Flickton for the third question. Ischemic optic neuropathy decompression trial for the fourth one. And the last one is macular infarction for gentamicin. Okay. Okay. Not bad.
So we move on to the next team, that is RIO Rohtak Warrior, team 15. Rohtak team, are you there? Team 15, RIO Rohtak Warrior. They joined and we spoke with them also. Okay, now let's move on to the next team, that is SVMC team 1.
Yes, ma'am.
Yes. So please introduce yourself.
Ma'am, I'm Lakshmi Sharma, final year resident from SVMC Tirupati. Myself, Dr. Shrivani, second year resident from SVMC.
Okay. So shall we start?
Yes, ma'am.
Yes.
Okay. So here are your questions. Who invented the charts shown below?
Pass, ma'am.
Okay. Visual field index in a normal eye is 100%. True or false?
False, ma'am.
Okay. White-centered retinal hemorrhages associated with systemic diseases are called? No. Expand crash?
Pass, ma'am.
Swinging flashlight test is done to detect?
RAPD, ma'am.
Okay. You get RAPD, right?
One wrong.
And one wrong. So VFI is 100%. That's true. So 10 minus 5. So that will be 5. The answers are Mark Amsler's. And second one was true. Then was Roth spots. That is a white-centered or pale-centered hemorrhages. And crash is corticosteroid randomization after significant head trauma, head injury. Last one, you got it right. Can we go to the next one?
So now the next team is team Venetia Shreya, team 17. Yes. We can't hear you. No.
Hello? Is the team there?
Ma'am, yes, team is there, but we can't hear them.
Oh.
Sai, can you help them out?
Just go.
Meanwhile, can we move on to the next team? That is team 18, Optimistic PB.
Ma'am, can you hear us?
Yes.
I'm Dr. Bhavya, second year PG, SRM College, Chennai.
I'm Dr. Pranauti, second year PG, SRM Chennai.
Okay. All the best to you. Can we have the questions?
Yes.
Okay. So who introduced streak retinoscopy?
Pass.
Okay, ICD-10 code for senile cataract is H26. True or false?
True.
True. Okay, classical sign in optic nerve sheath meningioma. Imaging.
Pass.
Okay, what is sight? Okay, manifest squint with a normal Worth 4 dot test indicates. Okay. So the answers are, first one is Copeland, which you did not answer. Second one is false, it's H25, you said true. Next one is tram track appearance, which you did not answer. Systemic immunosuppressive therapy for eye disease and ARC were the other answers. So they get -5. Do you really want to give them minus?
We'll see, ma'am.
Okay.
Ma'am, actually 4 teams na didn't join.
Okay.
So I'll stop sharing the screen.
Sure.
I'll hide the next 2 teams questions from your bank and 2 teams from the ma'am's bank. Okay.
Okay.
So
Okay,
that
fine.
we will move on to the Anuradha ma'am's questions.
Yes.
Yeah.
All the best to all the teams. Bye.
So meanwhile, team 17, Venetia, Shreya, please check your audios, please.
I have asked them to log in from their mobile, madam. They are logging in now.
Okay. So just give me 1 minute. I'm hiding the questions of the next.
Should we close this?
Different than usual.
Here we are audible. Ma'am, are we audible?
Yes, you are audible. So Anuradha ma'am?
Yes, Dr. Shreya.
Yes. So next team will be Team Venetia and Shreya.
Yes, ma'am. Good evening, ma'am. I'm Dr. Shreya from Osmania Medical College, Hyderabad.
I'm Dr. Venetia. We are from third-year residents from Sarojini Devi Eye Hospital, Osmania Medical College.
Be closer to the mic, please.
Okay, ma'am.
Shall we start?
Yes, ma'am.
Yes, ma'am.
Okay.
Local anesthesia for eye surgery was introduced by retinitis pigmentosa can be inherited through autosomal dominant, recessive, and X-linked inheritance patterns. True or false?
True.
Another name for RAPD is
Marcus Khan.
expand DRCR.
Diabetic research and clinical.
Angle subtended by 6/60 letter of Snellen's chart at 6 meters.
5 minutes.
Great.
Great.
The first team who has given the 4 answers.
Yes.
And they all are almost correct, but you should know about DRCR.
Yes, ma'am.
So how much marks do you want to award, Dr. Shilpi?
40.
40? Okay.
So
congratulations, girls.
So the first answer was?
Carl Kohler in the year 1884. First anesthetic used was cocaine. And the second one is true. And another name for RAPD is Marcus Gunn pupil, diabetic retinopathy clinical research network study. And last one is true, 5 minutes.
So the next team is Team 19, Optic Ninjas. Team 19.
Hello, ma'am. Are we audible?
Yes.
Switch on your video, please.
Yes. Yes, we can see you also. Yeah.
Okay. Hello, ma'am. Dr. Sumati from STM Medical College, Dharwad.
I'm Pragati from STM Medical College.
Be closer to the mic. Okay, we are starting with questions.
Who invented stereoscope? Ocular manifestation of systemic autoimmune disease always precedes systemic symptoms. True or false? Vertical pigment deposits on corneal endothelium associated with pigment dispersion syndrome. OHTS stands for which extraocular muscle is supplied by only one anterior ciliary artery?
Lateral rectus.
Okay. You want to answer any of the above questions?
Third one is Krukenberg spindles, ma'am.
Yes,
Okay.
right.
Second one?
And fifth is medial rectus. Second is false.
Fifth,
Second is
people
false.
told lateral rectus earlier. Now you want to shift to medial rectus?
Medial rectus.
You decide. Yes.
No, ma'am, we'll take the first answer.
Yeah, okay. Stereoscope was invented by Charles Wheatstone in the year 1832. Ocular manifestation did not always precede systemic symptoms. Vertical deposits on endothelium is Krukenberg spindle. OHTS stands for Ocular Hypertension Treatment Study. And the extraocular muscle supplied by only single anterior ciliary artery is lateral rectus. So you have got
40.
1, 2, 3.
Yes.
3 right.
Four.
Thank you,
Which
ma'am.
is fourth one, Dr. Shilpi?
Ma'am, they said false for the second,
Okay.
then Krukenberg's, and then this. Yeah. Okay.
Thank you.
So the last team for today's quiz is Alpha Squad, Team 20. We can't hear you.
Yes, ma'am.
Please be closer to mic and
Yes, ma'am.
introduce yourself.
Ma'am, myself, Dr. Ranjita Amanatya, and I am third year PG resident from Bhimsar, Odisha. And I am Dr. Sasmita Mishra, a second year PG resident from Vimsar, Odisha.
Okay, congratulations, girl. Can we start?
Yes.
Yes.
First successful human corneal transplant was done by
It was done.
color vision testing is not the definitive diagnostic criteria for retinal and optic nerve diseases. True or false? Ocular signs of superior cervical ganglion lesions. Expand AREDS. Crowding phenomena is seen in dash. Anyone you want to take?
They answered the second answer. What about the third?
Age-related macular disease. Age-related
macular
eye disease study.
Good. What about the third one?
Superior cervical ganglion lesion.
Okay. So the time is up. Ma'am, they answered 2 correct.
Okay. The first corneal transplant was done by Edward Zim in the year 1905. Color vision test is not a definitive diagnostic criteria. Yes, it's true. Ocular signs of cervical superior cervical ganglion lesion is Horner syndrome. ARDS stands for age-related eye disease study, and crowding phenomena typically occurs in amblyopia.
So plus 20 to them now. Right. Okay. So with this, we end with the rapid fire round. And now this is time for the last set of MCQs by Dr. Mamta.
Welcome back, and we'll start with the first question of third set of MCQ of this evening. The question is, FDA approved concentration of lifitegrast in Xiidra ophthalmic solution for dry eye is option A is 5%, option B is 4%, option C is 0.3%, and option D is 0.5%, and the time starts now. Time's up. The correct answer here is option A, which is 5%. Lifitegrast is basically anti-inflammatory agent which works against the inflammation-mediated dry eye, and it basically stops the T-cell mediated inflammation. So moving on to the next question, that is, a 5-month-old baby presents with leukochuria and linear truncal hyperpigmentation. Fundus evaluation reveals bilateral tractional RD. The most likely diagnosis here in this case is option A is incontinentia pigmenti. Option B is Nuri's disease. Option C is Walker-Warburg syndrome. or option D is xeroderma pigmentosa, and the time starts now. Time's up, and the correct answer here is option A, which is incontinentia pigmenti. These babies, they at the time of birth, they have this red papules and vesicles on their body, which gradually regresses over time and is replaced by linear hyperpigmentation. In 25 to 30% of these cases, we get to see retinal vascular occlusion, PVR, TRD, and vitreous hemorrhage, hence the retinal detachment, which was mentioned here. Moving on to the next question that we have. Normal basin fusional reserve for distance. Just pay attention, basin for distance. The options are option A, 5 to 10 prism diopter. Option B is 15 to 20 prism diopter. Option C is 25 to 30 prism diopter. And option D is 35 to 45 prism diopter. And the time starts now. The correct answer to 10 prism diopter. Fusional reserve, or fusional amplitude, is basically our capacity to see the image as single image or the single binocular vision against the basin or the prism, which is there in front of our eyes. So moving on to the next question that we have. Can I have the next question?
Yes,
Gene responsible for Meesmann dystrophy is, yeah, I got it. Gene responsible for Meesmann dystrophy is option A is KRT3. Option B is BIGH3. Option C is gelsolin gene. And the option D is K5Z. And the time starts now. Time's up. The correct answer here is KRT3 gene. These genes are basically responsible for keratin formation, and which is actually the cytoskeleton for cornea, as we all know. So it is the K3 or the K12 gene, which is the culprit here. So moving on to the next question. The last question for this round is false statement about aqueous misdirection syndrome. You need to find out which one is false here. The first option is, it is commonly seen in open-angle glaucoma patients after filtration surgery. Option B, these patients, they present with flat AC. Option C, discontinuation of cycloplegic can precipitate despite doing PI. Can we have the option D? Yeah. AC remains shallow despite a patent PI. And the time starts now. Time's up. The correct answer here is, it is commonly seen in open-angle glaucoma patients after filtration surgery. It's not that aqueous misdirection is not seen in open-angle glaucoma patients. It can be seen, but if we compare the incidence in cases with closed angle or shallow angle and those with open angle, then it is 0.06% in open angle and 4% in shallow angle or narrow angle glaucoma. So definitely it cannot be considered as a common occurrence after open angle glaucoma post-filtration surgery. So with this, we have come to the end of my set of questions. Over to you, Shilpi.
Thank you, Dr. Mamta. Thank you, Dr. Mamta, for wonderfully taking us through this round of MCQs over here. So now it's time for us to compute. So till the backend team is ready with the, all the computation, can I request all the quiz masters as well as all the team members to log in for some unofficial or rather routine chat over with us. Also request. Mr. Suryananand sir also to join us on behalf of His Highness. So request all the team members, come on, get your audio as well as video on. We'll have some informal chat. Meanwhile, till the team is ready with the computation.
Sir, you should have this session of, coffee with current coffee with,
So it is
similar
not.
kind, post quiz.
Yeah, so post quiz, it is not coffee with all the big quiz masters, Dr. Mamta, Dr. Anuradha, and Dr. Uma.
Oh, coffee with PV or SN.
Let's have the team. Let's have one by one. Let's talk about. Let's talk to team Abhi and Divs. Yes, team one.
Yes, sir. Yes.
Can you just introduce yourself and tell us, ma'am, Mamta ma'am, you can have small chat with them. They are from
I'm
Agrawal.
interested in knowing the name of this, Abby and Davis. I
Yeah,
I
what
was
was
really fascinated.
Yeah, please.
So I am Dr. Divya and this is Dr. Abhinaya. This is a short form of our names.
So it's Divs stand for Divya. It's like one.
Yes.
Who is
The
your
N
mentor?
Zen thing. Okay.
Who is your mentor for your team?
Dr. Preeti Naveen, ma'am, is our mentor, sir.
Okay, has she logged in today?
No, sir. No, she's not logged in.
Tell her that we missed her and your performance was good. Absolutely great. And
Thank you, sir.
convey my regards to Dr. Amar Agrawal and team. Okay?
Yes, sir. Sure, sir.
Okay. Now, can we have the next team? The next team is Team IQ. Oh, good. Meanwhile, we have the three private practitioners who are who have made it into top three. Can you just help me in reading this particular? Yeah. So it is 844478775773. Hello, can you hear me? The second is 8597993902. And the seed that is 83680822207. So I request these people who participated in private practitioner category to also join us on the Zoom platform for small informal chat.
Please raise your hand.
Raise your hand in the chat box so that we can
promote you
as a panelist, please. Okay. So meanwhile, we can have a small chat with IQ. So team IQ is from AIMS Chhattisgarh, correct?
Yes, sir.
So who is your mentor?
Dr. Somen Mishra, sir. Professor Dr. Somen Mishra, sir.
So Somen Mishra, sir, is with us?
Not today, sir.
Think all the team members who have logged into this and made it into quarterfinal one. It's such a big achievement for you. There were 380 teams who have in total participated and you are amongst those top 80 people. So you should share such a matter of pride to your mentors. Okay. So if you make it into next round, please do remember and convey our regards to Dr. Somen Mishra. Dr. Uma ma'am, can you just have a chat with these guys from AIMS? Chair.
Thank you, sir.
Hello. Dr. Prashant, I'm driving. I think you take over, please.
Okay.
I'm on the way back home. Sorry.
Okay. No issues. Okay. Dr. Anuradha, you are there with us? Dr. Anuradha?
Yes.
This is a team from AIMS. If you have some piece of advice for this guys or something like that.
Hi, among so many 300 plus teams you have been qualified. It's, I really, I appreciate your continuous efforts actually. So losing and winning is part, but then congratulations, keep the spirit going high.
Thank you.
Thank you.
Yeah, I really, all 20 of you, it's really, really good that you're taking part in such quiz programs. It will become a habit actually. So I think, you'll be, every time you read a topic, you'll start thinking likewise, like what can be, what is more important or what can come, or tomorrow you never know, you can be quiz masters too. So it's really nice. Keep going.
Good.
Thank you.
So now we can have I Ninjas. Dr. Mamta, you can interact with them. I Ninjas, where are you?
Hello, sir. Good evening.
We are from Arvind Coimbatore.
I'm in the ninja group.
So
you guys are from?
Ma'am, we are from Coimbatore.
Arvind Coimbatore.
So who is your mentor? Not Chandrasekhar for sure.
No, sir. Dr. Vijay.
Oh, yeah. She was the mentor even last year. Where is she? Has she logged in?
No, sir. Sorry, she couldn't make it out.
Guys, this time have not shared with your mentors. Mentors are all welcome. So henceforth, remember the participants as well as the people for following quarterfinals. Do ask your mentors, share this matter of pride that you are amongst the top 80 teams who have made it into quarterfinals, and invite your mentors. Every mentor would love to see your performance and they would be happy to see you doing well. Okay.
Sure,
So it's
sir.
a matter of pride. So best of luck and do
Thank you.
continue playing. We will let you know shortly the program means your status.
Thank
Team
you, sir.
Team Iconic. Yeah. Again from Coimbatore. Yeah, unmute yourself.
Yes, sir. Good evening, sir.
So again from Coimbatore.
Yes, sir.
Which year?
First year.
You joined this year?
Yes, sir.
I can't trust that. Mamta ma'am, Anuradha ma'am, if the first year residents are answering so well.
We were trying to, settle in first year. What is anatomy? What is, we were like.
Plus 30 in this rapid fire.
And in rapid fire, they have scored plus 30, where there was a negative marking. Absolutely great job. Huh? Great job.
Really nice. Yes, sir. It's really nice, actually. Most of the time, first years are very busy doing all the clerical jobs and then getting used to and then reading anat physio. It's really nice that you people are doing so well.
So you are in your 4th or 5th month of your residency?
Fourth month.
4th month. Salute. Seriously, a serious salute to you and your mentors who are really groomed you so well. Best of luck. Don't get flattered and just don't put on few more kgs. We have a long way to go. We have to reach quarterfinal, semi-finals and finals. Okay. Best of luck.
Thank you, sir.
Okay. Lensomedics. Team Lensomedics. Where are you?
Yes, sir.
Okay. Where are you from?
We are from Bharti, Pune, Bharti Hospital.
Bharti Hospital. So who is your mentor?
We don't have any mentor. Participated.
So who is the head of the department for you?
Dr. Tejashwini Khandgave.
Okay, fine. Do inform her next time if you make it into the next rounds. Request them that you have made your college so proud. See, they will be definitely happy to be a part of mentor and to mentor you further down the path. Okay.
Yes, sir.
So Pune, when हमारा महाराष्ट्र के लड़की है, good, आमची पोरगी, good, do well. Best of luck.
Thank you, sir.
Team Iconic.
Yes, sir. Good evening, sir.
Good evening, sir.
Where are you from?
GMC Aurangabad.
अरे क्या बात है, एकदम
महाराष्ट्र.
जय महाराष्ट्र हो रहा है, हैं?
जय महाराष्ट्र हो रहा है.
Good. So who is your mentor?
Dr. Shubha Ghonsikar, ma'am.
Okay, good. You have informed her or not?
Yes.
Yes.
She's listening to this, please.
She's around. Okay,
Yes,
ma'am,
sir.
are you there with us? Ask them.
Actually, she was, but maybe.
Okay, no issues. Chalo, do well. आमच्या पोरांकडे जायचं आहे. Okay.
Yes, sir, definitely.
Okay. Team V Bhagyashree. Acha, they have not come.
चार teams.
Okay. Team I Squad. Team I Squad. That is
Good evening.
Where are you?
Good evening, sir.
So where are you from?
We are from JJ Hospital and GMC Mumbai. GGMC Mumbai.
Madam कुठे गेल्या चांदे madam?
Sir.
Tell her you may tell her she would be very happy and she will definitely put on few more kgs when she
Yes, sir. We informed her today.
Tell her this was my code for
Yes,
her
sir.
and do
Yes,
convey
sure,
that
sir.
as well as the whole team from JJ.
Yes, sir. Thank you.
Sir.
Okay, then Team Oculus. Team Oculus, where are you?
Hello, sir.
So, Madam Uma, Madam, this is team from your end, your state, but I think you are driving. Dr. Anuradha, team from your state.
So definitely. I heard, yes, KMC and, participating. KIMS and KMC, na?
KIMS Bangalore, ma'am.
KIMS Bangalore, yeah. Girls, Vinuta is my student. Both Vinutas, in fact. One Vinuta was my senior and Vinuta right now is my student.
Yes.
Yes. So, and Kiran is my good friend. Kiran. So just convey my regards and good luck, girls. You're doing great job.
Thank you, ma'am.
So the next one again is Ironic Square from KMC Manipal. Madam, again from your state. Now they are dominating the because two quiz masters.
KMC people are always dominating, sir. They're pretty good at academics. Yes.
Seriously.
And I think Uma ma'am is there with you guys, and Sulata Bandari ma'am. I mean, lot of well-known people are there from your region. So just rejoice and take off all the knowledge that they can share with you guys, and do settle well, do well in life.
Thank you. Good. Team Avanshi, I think, is not there. Then Team Epic I from MY Medical College, MP, Indore.
Evening, sir.
कहाँ से हो भाई? कौन से कॉलेज से हो?
Sir, MG Medical College Indore.
कौन है आपके फैकल्टी? कौन है प्रोफेसर? कौन है आपके?
Sir, Dr. Preeti Rawat ma'am, Dr. Shweta Walia ma'am.
श्वेता वालिया मैडम को बोलिए कि आई नहीं है, आपने गलत काम किया, उनके बच्चे इतना अच्छा परफॉर्म कर रहे हैं, शी शुड हैव बीन द फर्स्ट पर्सन टू बी विद अस, है ना? ये हमारी कंप्लेंट है, बता देना मैम को.
Yes, sir.
बेस्ट ऑफ लक, बेटर डू वेल.
Thank you, sir.
Oh, this is a in-house team for you, Anuradha ma'am. Glaucoma Flecken from Minto. Glaucoma Flecken. Where are they?
I'm not sure. Are they from Minto?
Yeah, they have written Minto, na?
Yes.
Glaucoma Flecken. Team Glaucoma Flecken. We are missing them.
Yes, ma'am. They are from Minto, Bangalore.
They are from Minto, Bangalore.
What are their names? I think I didn't notice.
Okay.
Sorry, we don't have the names. We only have the team names with us.
Where are you gone? Team Glaucoma Flecken. Madam Anuradha ma'am, probably.
I'm from glaucoma department, so I would love to see them.
I think they are afraid.
Madam would have treated them very well. All the glaucoma fleckens.
Okay. So we have then Team SVMC, Team 1 from Ruya Hospital, Tirupati. Where are you?
Good evening, sir.
So which college? Can you
We are
tell?
from Sri Venkateshwara Medical College, sir, Tirupati, Andhra Pradesh.
But Balaji.
Yes, sir, Tirupati Balaji. Our mentor is Dr. Chalpati Reddy, sir.
Good. I know him. He's a dear friend of mine. Do convey my regards to him.
Yes, sir,
And
definitely.
because you are in such a divine atmosphere, you must be there. So all the blessings. So naturally, beyond your studies, his blessings definitely make a lot of sense, and probably his contribution where you are here.
Thank you so much, sir.
Take care, better. Do well.
Thank you, sir.
Now we have Veniti Ashriya from Sarojini Devi Eye Hospital.
Good evening, sir.
So how is Pandharpur command?
She's well. She's doing well, sir.
So who is your mentor?
Dr. Afrin Khader, ma'am. Sir, she's with us, sir. She's joined actually.
Madam, please do join us. Please get your video on. We would definitely love to have a small chat with all the mentors who are responsible for such a wonderful achievement of their kids. Do I see them, ma'am? Is she still in the group? I think we are missing. Do you see, Dr. Shreya, do you see them on the participant list? I can request her to join.
She joined, sir.
Okay. No issues. We are missing her at this point. Ma'am, our regards to you, and we are so proud of you. Thank you for making your students so proud, and they could make it into the top 80 teams. We are very proud of you. Good. So the next team is Optimistic PB. That is from SRM Medical College, Tamil Nadu, Chennai. Where are you, Optimistic PB?
Good evening, sir.
So Ramchandra Medical College, huh?
No, sir. SRM, sir. It's different.
Okay. Who is your who is the professor and head at your place?
Dr. Venkateshan, sir.
Okay. So who is your mentor, by the way?
Dr. Aishwarya, ma'am.
Oh, good. Congratulate her and tell her that you were amongst the top 80 teams. She would be definitely proud, and it is quite flattering to know all students doing well. You are a first year, second year, or final year residents?
Second year.
Oh, good. Do well. Best of luck.
Thank you.
Then we have Optic Ninjas. Optic Ninjas, ma'am.
Good evening, sir.
From your state again.
Lots from our state.
Hello, ma'am.
Hello.
Yeah, Medical College, Harvard.
Harvard Medical College.
Harvard.
Oh, cool, yeah, cool. So I think your HOD is my friend's friend. Which year are you guys in?
Third year.
Third year?
Yes.
Okay, great. Yeah, really nice.
Good.
Congratulations.
So
Thank
best
you.
of luck, and you have to continue performing well. So the last team for today's thing was Alpha Squad from Vimsar, Burla, Odisha. Yeah.
Yes, sir. Yes, sir.
मैडम ममता मैम आपके ईस्ट साइड की टीम है ये?
हाँ जी सर मैं which year girls?
Ma'am, I'm from third year and she is from second year.
Great, great. You're doing wonderfully well. I hope इस round के आगे भी जाओ.
Yes.
ठीक है. Someone artist from the east.
I identified her from eastern side because Dr. Mamta, before she joined AIMS, was in RIO Patna, so eastern side. That's the reason why I pointed out that particular
I
place.
still belong to that place, sir.
Yeah,
I can
I
forget my
understand
rules.
the attachment. Good, good, good. Thank you everyone. So I think we have the private practitioner category. Anyone has logged in?
हाँ, विनीत है, क्यू मंडल.
विनीत, आ जाओ यार. क्यू मंडल और
हेलो सर.
सूर्यनारायण सर आइए आप थोड़ा सा ये बच्चों के साथ. ये विनीत जो है ना, डॉक्टर मिस्टर सूर्यनारायण फ्रॉम हिज आईएनएस. विनीत यार,
हाँ जी.
बाकी लोगों को मौका कब दोगे? ऐसे से तुम हिज हाइनेस टीम का पूरा पैसा तुम ही कैसे से पूरा चुरा लोगे. हर बार तुम ही लेके जा रहे हो. बता दो फॉर द सेक ऑफ ऑडियंस, हु आर यू?
I am Dr. Vineet, currently working as senior resident in Retina and ROP services at RP Center, AIMS, New Delhi.
Good. Congratulations, Vineet. We are so proud. You are an habitual winner and you pocket. I know every alternate, I think you keep on winning the prizes. Best
Thank
of
you,
luck.
sir. Thank you, sir.
Dr. Q. Dr. Mandal.
Good evening, sir. I am Dr. Q Mondal, senior resident from AIMS Raipur.
एम्स रायपुर. ये तुम दोनों तीनों मिलके ही पूरा हमें लूट लोगे यार. ब्रेन टीजर्स टीम का पूरा पैसा तुम लोग लेके जा रहे हो. Good, good. Congratulations. Keep playing. We love to see you young guys participating and still fighting and having the thirst and eagerness to fight and learn. We are so proud of you being associated with us on and off every time. Okay, keep playing best. Best of luck. Okay, so are we going to declare the prizes? No. Okay, so we are here at the conclusion of quarter final 1. So all the teams, congratulations, who made it into top 80 teams, all the 20 teams who played well. Let me congratulate you as well as all your mentors who made you competent enough to stand up in this competition, such a tough competition. So with these words, we are going to have quarter final 2 on the coming Wednesday at 7:30 again. So that date is going to be 23rd of April. So be ready. Teams, remember your result. We will be declaring who are the semi-finalists at the conclusion of all 4 quarterfinals. So do log in for other quarterfinals so that you also learn how the further quiz is going to progress. And it would help you out further, not only in gaining the knowledge, but if you are into those semi-finals, it might add you more knowledge so that you become more versatile and more
You can play as a private practitioner.
But in that categories, you play as a private practitioner category so that you can keep your thirst for the knowledge on. So, Suryanarayan sir, are you there with us before we sign off? Anyone from team His Highness? Naresh? Okay, I think we are missing the team from
Sir is online. I think he's not listening to us or something.
Yeah, okay, no issues. So friends and all the participants, thank you once more for logging in and playing this quarterfinals one so well and making it so interesting for each one of us as a viewer as well as a quiz masters for all of you. My sincere most thanks to Dr. Anuradha, Dr. Mamta and Dr. Uma ma'am for making this quarterfinal one so interesting and taking so much of efforts for these postgraduates and making them think and learn as well as having some fun for them. Thank you, everyone. Thank you, everyone. Thank you, Sai and his team. Thank you, team His Highness. So it's time for us to sign off. Bye-bye till then. Okay.
Thank you, sir.
Bye-bye.
Thank you for making me a
Thank
part
you,
of
Dr.
it.
Shilpi.
Thank you. Bye-bye. Thanks.
Good luck,
Bye-bye.
everyone.
Best of luck.